The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. I appreciate you joining our meeting today on this new A19 that's come out. A couple of housekeeping items first, just to touch base on. This is a prevention-only A19. And one thing to note is we're not changing your billing procedure at all. So the same way you've been submitting it for payment remains intact. This is just a way of combining all of your prevention work onto one A19. I want to mention also to save your questions. You can type them in as we go. We won't address them till the end of this presentation due to the fact this is being recorded and posted on the Athena forum afterwards. That way people can follow it without the interruptions of questions. And if after I'm done you still have program level questions, please refer to your PSM to answer those. And those refer to CSAP strategies and IOM if you still have questions surrounding those. So with that, I'm going to look at our new A19, eventually A19. And if I haven't mentioned already, this is Scott McCarty, and I'm with DBHR. So let's do one thing first here. Let's have everybody raise their hand so we can look and see if indeed it is all working.
Hands are coming up.
Hands are coming up. Fantastic. Okay, so now we're going to go into this. As you see the top part here, this is going to look very familiar to the A19s you already received. One thing to note is if you are receiving partnerships for success funding, this A19 is going to cover both contracts. So if you look under right here, agreement ID or contract number, you're going to see that there's two different contract numbers. This one's going to represent your SAP, which is also the SGIA, the State Grants and Aid. And the second one here is your Partnerships for Success grant number. And these do correspond to the contract number here and here, just for reference. So this form will come to you populated with these top sections as you're normally used to seeing. And what you want to look here is month of service. This is important to put in. Received by, date received. This is just kind of your housekeeping stuff and also when you send back to us. Now the big difference you're going to see here is that the requirements are to be reporting by program, CSAP strategy, IOM, and then how much money is spent based upon the contract. Now, if you're not receiving any partnerships funds, you're not going to be utilizing this column here at all. You're still just going to see the one contract number, and you're going to worry about these two columns here. If it's grayed out, that means don't put anything there. It doesn't pertain to the category. So if you look here on the left-hand side, you see the bars category, and these do coincide to your CSAP strategy as well. So if you look here, you see county-only administration. The only spot where you could possibly bill for that is under partnerships. So again, if you don't have a partnerships contract, it's going to be grayed out for you. Bars 21 there, and these are preset. These first few that you see are going to be preset, so they're going to show up on every A19 that you receive. Community-based coordination, and that's prevention only. As you can see, there's a spot under SAPT where you can enter funding, and this is where you put the dollar amounts that you're actually utilizing. So say, it was $100 there, and you used $50 from partnerships. So that's how you would just enter that in there, and it's going to total it up there, and then when we get down to the bottom, I'll show you how it does a summary for you as well. Look here, 22.5, Community Coalition Coordinator. This is where, and here we're already going to populate your CSAP strategy and IOM for you. And again, then you put your dollar amounts across. Same with Community Coalition, across there, and then training. You're going to put the dollar amounts there. Now here's where you're going to have to enter in programs that you run within the month of service that you're billing for. So we're just going to run through an example here. So we'll go there, and if you look, when you enter the bars number there, it's going to automatically populate your CSAP strategy for you. So then what you would do is you would enter in your program. And then the IOM strategy. Then you'd go through and you'd enter in the funding based upon the source. And you're going to do this for every program that you run within the month of service that you're billing for. If we scroll down to the bottom here, this isn't something that you're going to be populating, but this is where it will summarize what you're entering up above, and this is what our accounting department uses to issue payment. And it is as simple or complicated as that, depending on your point of view looking at it here. You know, I could sit here and go through numerous examples, but it's pretty much going to look the same as this line item here, just time and time again. So at this time, I'm going to open it up to questions that our audience may have.
So folks on the phone, this is Ray Horodowitz. I'm Robin to Scott McCarty's Batman today. And if you do have a question, you can either raise your hand, use the raise your hand feature, and then we could work to unmute you, but that would only work if you entered your audio pin. The other thing you can do is use the chat or question box and type in your question that way. Okay, questions are coming in. So I'll kind of dive in and start reading these questions out loud. Pardon if I start paraphrasing or jumping around if certain questions get repeated. So we have a question coming in. To make this simple, can we list all our programs and only fill in the ones we use each month?
Absolutely. That would actually be a very good way to do it, and we do encourage people who are filling this out to do just that. Excellent question.
All right. Next question. And again, I haven't kind of read through these, so bear with me. We are a community, not a county, because we have no county coordinator. For the admin on Partnership for Success funding, do we still use the 11.1?
Yes, you would.
All right. And I'm taking a moment to make sure the answers are digested by everybody. Could you scroll down so we can see the categories on the bottom again, please? And folks on the phone, these were, if it's helpful, you may want to have your own digital copy of your specific A19 open in front of you, and they were primarily sent out last Wednesday the 19th. They would have been sent out by Steve Smothers. Batman, are you ready for your next question?
I am ready.
Okay. Adam's A19 doesn't have the 22.6 choice for environmental. How do I get this added?
It probably obviously got deleted somehow.
Okay. So Vicki, if you are kind of watching this and you see Scott did the pop-up menu, so if you could just kind of confirm that when you click on that down arrow, 226 does not show up, but the others do. I'm going to move on to the next question. We have a question about asking what the SGIA stands for, and if all the communities do have that.
No, it stands for State Grants and Aid, and to my knowledge, there's only 1 or 2 counties that actually have that. So it's not really a column that most individuals are going to need to be concerned with. Those who do have it are going to be very familiar with it. So if it's not anything you've ever dealt with before, you're not going to be in the future as well.
Okay, next, well, we have 2 compliments, great idea and thanks. So thank you for the great idea and thanks. And then what, if any, will be the interface between PBPS entries and the info entered in this A19?
Well, the information that's entered on this will, after the fact, be loaded into PBPS once that A19 billing module is available within PBPS. The nice thing is that the form you're looking at here will most likely be the output that's produced through that same PBPS system. So once you become accustomed to using this form and saying you print out a paper copy and that's what gets circulated around your organization, that process won't have to change for you, nor will people have to refamiliarize themselves with a new form.
So questions are continuing to come in. I just want to remind folks that if you'd rather raise your hand and ask your question directly, we do have that option. Let's see. We do have a question about when it comes to the barcodes, what's the difference between 21 and 22.5? 21 being community-based coordination and 22.5 being community-based process.
So this is Steve Smothers. Community-based coordination is for those counties who are still doing county-wide work, those counties that have more than $110,000 in each one of their communities, and they're able to use those dollars to do county-wide services still. There's a few counties that have enough money to do county-wide services still, so they will continue to report those county-wide services under community-based coordination.
Looks like we have, Vicki did confirm with the Adams County that one's not listed. For folks that are typing in issues specific to your A19, we may not say those out loud, but we are keeping track of all these questions that come in. We have another, but if your A19 does not have that listed and you have entered it in, save us a couple of seconds by mentioning what county or what community you're from. Okay, our next question, when you send the reimbursement, will it indicate which contract the money is for? So if I understand that question, A19 comes in, it may have something under the SAP block grant and something under Partnership for Success. Will that community or county receive one invoice, one payment from us, or would it be split between, would they receive 2 payments?
I don't know. That's an accounting question. It's an excellent question, and we will follow up with an answer for that, because I can't speak to the process that accounting will use for this.
What was the question?
So the A19 will have money charged to the block grant and money charged to Partnership for Success. When they receive payment, will they receive one payment with both of those amounts, or will they receive two payments, one from the block grant, one from the Partnership for Success?
That's a question we have to get back to them. I'm thinking it would be two separate payments because they have to track them both debts separately.
I think two separate people actually process it.
Yeah.
Okay. We have a question about two of the fields on the form. Towards the top, there's the received by field. Who fills that out? What goes in there? And then at the bottom, there's the prepared by field.
Those can be different people. If someone in your office is receiving it, but they're not actually the ones that are populating it, it's a way of internally tracking when it was received and the date that the document was actually received. And then the second one that was referenced is who is actually going through and populating the bars and program and dollars on there. And that's the difference.
We have a question about how soon do we start using the form?
It's effective now. You can submit it with your next billing.
Steve, we have a request of someone asking you to repeat what the difference between bars 21 and 22.5, and it may be because we need to bring the phone closer to you. Yes.
So the difference is community-based coordination is where if you're a county and you have enough dollars to do county-wide work still, then you would report county-wide work on the community-based coordination. There's a few counties out there that have enough money to exceed $110,000 in each community, and they're able to still do some county-wide work. So those dollars would be reported under community-based coordination. Rather, most folks don't have over $110,000, so all of their funding will be reported under a community-based process when appropriate.
We still have some more questions, and again, folks do have the option if they want to ask the question out loud, raise your digital hand, and we will unmute you. Okay, we have make sure I'm reading this correctly. Usually the EFT identifies the contract source.
Electronic fund transfer? Is that what they're referencing?
Electronic funds transfer, that's probably it. And so if I can jump in, then if there's going to be two EFTs, then it would identify each source.
Yeah. Again, that's accounting. We'll follow up with this accounting question so you'll know if you'll receive separate deposits based upon the contract number or if it's one lump sum. Our guess is it's going to be separate.
It'll be separate because it's two different contract numbers.
Yeah, there you go.
Okay. Next question. Since this is starting mid-year for the block grant funding, how will this eventually reconcile with the budget document we just completed?
We're separating them here. So if you completed one for January, we'll, and if you're on the old A19 and you want to submit on the new A19 in February, we'll just track the dollars on our end. We'll reconcile on our end.
We have trying to clarify, this person on their A19, they're not seeing education or environmental. So will that be under the individual program now? And listed as, prescription take back or second steps?
We'll have to send them an updated A19.
Okay. So Steve Smothers just commented that if there's something not showing up on your A19, we'll resend the A19 so it doesn't include that.
All the A19s should look alike. So if you see something on here that you don't have on yours, please let us know and we'll get you a revised A19.
There is a federal ID number or social security number. Would we enter the agency federal ID number here or the counties?
Depending on who the funding agency is. If you're one of our direct contracts with the school district, then you would enter that number, federal ID number. If you're a county, then you would enter the counties.
And Steve, if I could kind of further clarify that, all the contracts that go out, there's a federal employer identification number. So then that number should match this number. Does that sound correct? Okay. When reporting, next question, when reporting education, can you roll each strategy under one total, or do you need to report each strategy individually?
You need to report each program individually, and that would be by strategy. So there's no way of combining multiple programs together, even if they do share the same strategy.
This may be kind of a follow-up to the earlier question about budget document and reconciliation between documents. The time period for the budget document is July through June for the SAT. How will the first 6 months of billings eventually reconcile with the budget document, or will it?
We'll reconcile here. I don't have to worry about it. We'll reconcile it all here. We're acting as the new A19 is just combining the partnership dollars. When you submit the new A19 and you have dollars on there for SAP, it's going to follow your old A19s, and we'll reconcile it all here.
I think I'm scrolling through the list now to see if there's any that we missed. Again, if you've sent in a specific issue with your A19, such as the 226 barcode is not on the list, we're not going to mention each of those on this call, but be sure to help us out by identifying your county and community. Are the programs we are listing on the A19 the same as the programs we listed on the budget document?
Yes, your approved programs that you have in PBPS or in your budget document that your system manager approved programs that you list. So if you have programs approved that were before partnership, you list those if you're going to continue to use them in bill SAP, and any additional programs that were approved when you receive partnership dollars, you list those also.
I don't see any hands, and I don't see any more questions that we haven't addressed.
Can we do a quick poll and find out who the audience is, who we have out there? We have physical folks, program folks.
It will take me a minute to do that, but I think I can do that.
Hang tight, everyone. We're going to put a quick poll out there just so we can see the mix between fiscal people and program people that are out there, so we can kind of get an understanding of our reach today.
There we go. Okay. Oh, but I don't have that one.
So kind of go fiscal, program, county. Or contractor. School space or something.
So we can see that folks are already responding to the poll. We'll keep it open for another 20 seconds or so.
Pretty good turnout.
We're now going to close the poll and share the results. Can everyone in the room see that okay?
So it looks like we had a pretty even split between fiscal and coalition coordinator folks and a few county folks on there. So it looks like we have the right people in the room or on the webinar. Good.
And again, I want to reiterate this webinar will be available on Athena. It'll get posted there. So if questions arise with somebody else in your agency, you can direct them to Athena, and they can review the first few minutes of this, especially just to kind of get a feel for the document.
We do have some new questions that have come in. And let me just, where does a community organization enter the staff coordinator?
Community-based practice.
Yeah, isn't that the community coalition? Yeah. So as you see, the fixed 22.5, the first one, community coalition coordinator, it would go under that line item.
And then this question came in, if our county has more than one community, do we submit an A19 for each of those communities?
Really?
Yeah, yeah, they do. Yeah, they do. Yeah.
But we don't have separate contracts with those.
How would they cost it all out? Well, they have to. They all have separate budgets. Yeah.
So to clarify or to repeat, the answer is yes, separate A19 for each community.
Yeah.
I am expanding on this particular question that came in, but earlier we talked about we do want communities to go ahead and list out all their approved programs on the A19. And the question is, can folks out in the field enter the program themselves, or do we need to enter them? Okay.
Yeah, we would suggest actually with the first one that you receive, enter in all the programs, and then you can save that, and then in subsequent months, now you're going to have all the programs listed out, and it should make the process go a little bit smoother for you moving forward.
We are able to change a currently budgeted program with our prevention system manager before billing, correct?
Yeah, nothing's changed.
Yes. Nothing. So for folks on the phone, that is correct. Nothing has changed in that regard. If we have additional questions after this webinar, who should we call?
System manager.
We have a comment. These are good questions, and will the questions today also be on Athena?
It's recorded. We can do it.
Yeah, we will make these questions available for people to review. So that way, these are more common questions that are going to reoccur. People can review the questions and answers ahead of time.
And keep in mind, folks, if you've entered a question that's kind of specific to your A19, some of these questions aren't being read out loud, so we could kind of address those on an individual basis. And still don't see any hands raised for folks that want to be unmuted and ask a direct question.
Okay. If we don't see any new questions come in the next minute or so, we'll go ahead and conclude.
We have a request in asking if it's possible for us to kind of create a sample A19 with different programs, et cetera, so folks out in the field could have an idea of what one would look like.
Sure. I will go ahead and get that created and, again, post it on Athena for you to have an example.
And Scott, keeping in mind there's a variety of folks on the call, can you review what the acronym IOM is and or how it relates to this?
It's Institute of Medicine, and it's the, I don't know the best way to explain it, though.
It's the population they serve.
Yeah, it's their population category, kind of the reach of the strategy.
Selected, indicated, and universal.
And if I can, be Mr. Moderator, this is a piece of information that the Partnership for Success grant requires. That's why it was added to the A19.
Correct.
We have an awesome thank you that has come in. There's a fiscal person asking about Athena. I'll respond to that. You can either work with the coalition staff person about access to Athena, or if you want to jot down the website quickly, it's www.athena.org. theathenaforum.org, and information from that website. You don't need a login to retrieve information, but you do need a login to be able to post information. With the clarification about the IOM, we have a couple of other follow-up questions, but unless we want to take the time now, I think that's something that the system managers could reach out and connect on. And again, if your A19 is missing one of the barcodes or whatnot, when you type in your chat, if you could mention the community and the county, that will help us make sure we get to that a bit quicker.
Are there any new questions?
I'm scanning through the list to see if there's any that we've skipped over by chance. And again, if there's still the option to raise your digital hand if your question has not been addressed. Someone reminded us that what you still see on the screen right now is the poll, so we will get that closed.
Any more questions?
Any more questions?
I was really hoping someone would raise their hand.
Well, we'd like to thank everyone for joining us. And again, this will be posted on Athena that you can follow up with. If you have program level questions, please follow up with your system manager.